I was reading where oncologists did not feel like telehealth was a great experience for them during the pandemic, and it's one of the areas that's really going back to physical visits a lot quicker. Is that what you're finding there, or is it a little different?
No, we're embracing virtual care. We had already contracted with Amwell before the pandemic, and we were doing the design work, and then the pandemic hit. Because at that point we were doing only about 10 visits a day, predominantly international medicine, leveraging other platforms. But once the pandemic hit, we did an immediate rush on Amwell. We stood it up manually with no integration with our Epic EMR for scheduling and so forth. So it was a little challenging, I think, the first couple months, but once we built in that integration for scheduling where the physicians never had to leave Epic, and we were really able to leverage the Amwell platform, we went up to hundreds of visits a day. And we're still at that level, and we expect to stay at that level well into the future, Bill. So we're not going to be reducing that. We did see a decline in ambulatory clinic visits because of the pandemic, and we now see that slowly recovering. Although, the Los Angeles area has just been hit very hard with the pandemic, and so there was a decline in visits, but we're still keeping the pace with virtual care, and we're expecting the visits to return this summer back to normal levels.
Did you guys have to care for COVID patients, or were you more because you're specialized, didn't have a lot of COVID patients?
We've been taking care of COVID patients since the spring, and we've had to expand our ICUs with the reverse pressure and all of that. We've had to expand that, but we're experts in working with patients with compromised immune systems anyways. So it was pretty natural for us to take care of COVID patients. It's just that the patients with the comorbidities and everything is always very challenging. But yes, we've had our surges of COVID patients as well, and it's been tough. I'll say it's been tough.